Magnesium is a mineral supplement that is used to prevent and treat low levels of magnesium in the blood. It is also used to treat symptoms of too much stomach acid, such as stomach upset, heartburn, and acid indigestion. This mineral is essential for the normal functioning of cells, nerves, muscles, bones, and the heart. Normally, a well-balanced diet provides enough magnesium, but there are certain situations that can cause your body to lose magnesium faster than you can replace it from your diet. These situations may include treatment with water pills, a poor diet, alcoholism, or other medical conditions such as severe diarrhea/vomiting, stomach/intestinal absorption problems, or poorly controlled diabetes. The daily recommended intake of magnesium varies by age and gender, but it is generally safe for most people when taken in recommended doses. It is often best to take magnesium with a meal to help with absorption. When taking magnesium supplements, it's important to follow the directions on the product package. It's best to take them with a meal to reduce stomach upset and diarrhea, unless otherwise directed by your doctor. Make sure to take each dose with a full glass of water, unless your doctor tells you otherwise. If you're taking extended-release capsules or delayed-release/enteric-coated tablets, swallow them whole and do not crush or chew them. If you're taking chewable tablets, chew them thoroughly before swallowing. And if you're using a liquid product, be sure to measure the dose carefully with a medication measuring device. Taking magnesium regularly at the same time each day will help you get the most benefit from it. The dosage will depend on your medical condition and how you respond to treatment, so make sure not to increase your dose or take it more often than directed. This could cause serious side effects from too much magnesium in your blood. If you experience symptoms of low magnesium levels, such as muscle cramps, tiredness, irritability, or depression, make sure to talk to your doctor. If you think you may have a serious medical problem, seek medical help right away. If you experience stomach upset or diarrhea while taking magnesium, try taking it with a meal to reduce these effects. If these symptoms persist or worsen, it's important to contact your doctor or pharmacist right away. While serious side effects are rare, it's important to seek medical help if you experience symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. As for the daily dosage and optimal timing of magnesium, it's best to follow your doctor's instructions. They have determined that the benefits of taking this medication outweigh the risks of side effects for you. If you have any concerns or questions, it's always best to consult with your healthcare provider. Before starting a magnesium supplement, make sure to talk to your doctor or pharmacist if you have any allergies or kidney disease. Some forms of magnesium may contain sugar, aspartame, or alcohol, so if you have diabetes, alcohol dependence, liver disease, or any other condition that requires you to limit these substances, be sure to ask your doctor or pharmacist for advice. If you're pregnant or breastfeeding, it's important to discuss the risks and benefits with your doctor before using magnesium. It's important to be aware of the potential for drug interactions with magnesium. Magnesium can bind with certain medications, preventing their full absorption. If you are taking a tetracycline-type medication, it's best to separate the time of the dose from the time of the magnesium supplement dose by at least 2 to 3 hours. The same goes for bisphosphonates, thyroid medications, and quinolone-type antibiotics. It's important to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Also, be sure to check the labels on all your prescription and non-prescription/herbal products, such as antacids, laxatives, and vitamins, because they may contain magnesium. Ask your pharmacist about using those products safely. Always keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. If you or someone you know has overdosed on magnesium and is experiencing serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center immediately. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include slow heartbeat, severe drowsiness, dizziness, confusion, muscle weakness, and loss of consciousness. So, it's crucial to take the recommended dosage and not exceed it. Always consult a healthcare professional before taking any supplements. When taking magnesium, it's important to have regular medical tests to monitor your magnesium levels and kidney function. Make sure to keep all your medical appointments and consult your doctor for more details. Magnesium supplements come in various forms and strengths, and some are available over the counter. It's best to ask your doctor or pharmacist for help in choosing the right product for you. In addition to supplements, you can also increase your magnesium intake by consuming a well-balanced diet. Foods high in magnesium include avocados, bananas, beans, whole grain cereals, green vegetables, and nuts. As for the daily dosage, it's important to follow your doctor's recommendations. The optimal timing for taking magnesium supplements may vary, so it's best to consult with your healthcare provider for personalized advice. If you forget to take a dose of magnesium, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take extra to make up for the missed dose. When it comes to storing magnesium, it's important to keep it at room temperature and away from light and moisture. It's not a good idea to store it in the bathroom, and always make sure to keep it out of reach of children and pets. Also, it's important to remember not to flush magnesium down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, make sure to properly discard the product. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.